Imagine this. You're standing at the kitchen counter making your morning tea, and after just a few steps, your calves start burning like you ran a marathon. Your feet feel like blocks of ice even though the house is warm. By evening, your ankles look like they belong to someone else, swollen and tight, pressing against your socks. You brush it off. I'm 70, what do you expect? But what if those signals aren't just age? What if some of the very pills you take every morning to protect your heart, control your blood pressure, or ease your arthritis are quietly tightening the blood flow to your legs? I've seen this exact story in my exam room for 35 years. As a Chinese-American physician and professor of medicine, I grew up watching my own grandfather in Guangdong lose his ability to walk the village paths because his legs simply gave out. When I came to this country and started practicing, I realized many of the medications we prescribe with good intentions can create the same hidden problem. The good news? Once you see the connection, you can do something about it. You can keep your independence, keep playing with your grandchildren, keep walking through the park without having to stop every 10 minutes. Your circulatory system is not some abstract medical concept. It is the river that keeps every cell in your legs alive. Your heart pumps oxygen-rich blood down through the arteries. Those arteries branch into smaller and smaller vessels until the blood reaches the tiny capillaries where oxygen and nutrients cross over to feed your muscle fibers, your nerves, and your skin. Then the blood, now depleted, has to fight its way back up through the veins. In the legs, that journey is uphill, literally against gravity. Your calf muscles act like a second heart. Every time you take a step, they squeeze the veins, pushing blood upward. One-way valves inside those veins keep the blood from falling back down. When that pumping action slows, or when the vessels themselves become narrower or stiffer, the whole system backs up. Waste products stay trapped in the tissues. Nerves start misfiring, muscles cramp, skin changes color. That is poor leg circulation in real life, not in a textbook. For decades, we blamed only smoking, diabetes, and hardened arteries. Those are still major culprits. But in my university research and in thousands of patient visits, I have watched certain medications repeatedly surface as silent contributors. They don't announce themselves. They simply change the width of your blood vessels, thicken your blood, or trap fluid in your lower legs until one day you notice you can't keep up with your spouse on your evening walk. Let me show you exactly how this happens and which 9 categories of medications are most responsible. I will also give you the practical steps my patients have used to fight back and reclaim their mobility. Because the difference between struggling to reach the mailbox and walking your grandson to the bus stop can come down to understanding these connections. First, let's make the warning signs impossible to ignore. When blood flow drops, your body sends clear messages. Listen to them. The most common is claudication, that deep aching cramp in the calves or thighs that appears when you walk and disappears when you rest. It is your leg muscles screaming for oxygen they are not receiving. One of my patients, Mrs. Wong, 74 years old, used to love dancing at our community senior center. She told me her legs would tighten up after one song. She thought it was normal. When we adjusted 2 of her medications and added simple calf pump exercises, she was dancing again within 6 weeks. Cold feet that never warm up, even under blankets. Tell you the arteries are not delivering enough warm blood. Tingling or pins and needles means the nerves are starved. Skin that looks shiny, pale, or develops a reddish-brown discoloration is starving for circulation. Hair disappearing from your lower legs and toenails that grow thick and slow are classic signs. Sores on your feet or ankles that refuse to heal can become dangerous because the repair crew, your blood cells, cannot reach the injury site. Swelling is especially deceptive. Many older adults accept puffy ankles as part of life, but when fluid builds up, it compresses the tiny capillaries and lymphatic channels, making circulation even worse. It becomes a vicious cycle. I remember Mr. Chen, the retired engineer I mentioned in previous talks. His feet were so cold he wore socks to bed in July. His medications were part of the problem. Once we identified which ones and made targeted changes, the coldness lifted and he started walking his neighborhood again every morning. If any of these sound like your daily reality, stay with me. The next section is where we name names. Let's go through the 9 categories one by one. I will tell you exactly how each one affects your legs, why it happens at the cellular level, and what real patients experience. Beta blockers come first. These are the drugs like metoprolol, atenolol, and carvedilol that doctors prescribe after heart attacks, for high blood pressure, or to control irregular rhythms. They slow your heart rate and reduce how hard the heart contracts. That protects the heart muscle, but many beta blockers also block receptors that normally keep the arteries in your legs relaxed. The vessels tighten, blood flow drops. Your feet turn cold. Your calves cramp sooner when you walk. I have had patients tell me their legs feel heavy, like they are walking through wet cement. One gentleman, a former mail carrier, said he could deliver mail for 8 hours in his younger days, but after starting metoprolol, he could barely make it to the end of his driveway. We switched him to a different class of blood pressure medicine that did not constrict his peripheral vessels. Within a month, he was walking his old route again, this time for pleasure with his wife. Next are the dihydropyridine calcium channel blockers, especially amlodipine. These medications are supposed to relax arteries and lower blood pressure. They do that very well in the large arteries, but they often cause a peculiar side effect. Fluid leaks out of the blood vessels into the tissues of the ankles and feet. The legs swell. That swelling presses on the smaller vessels and actually reduces the very circulation the drug was meant to help. Patients describe their legs as tight, heavy, and throbbing by the end of the day. Skin can become so stretched that minor scratches turn into slow-healing ulcers. I have seen this so often that when a patient on amlodipine walks into my office with swollen ankles, the first question I ask is how long they have been on the medication. Sometimes we can lower the dose, add a mild diuretic under supervision, or switch to another agent entirely. The swelling retreats and the skin on their legs regains its normal color. Diuretics, the so-called water pills like hydrochlorothiazide and furosemide, present a more subtle problem. They pull fluid from your body to lower blood pressure or treat heart failure. When used aggressively for years, they can reduce total blood volume too much. The blood becomes thicker, harder to push through narrow leg vessels. Electrolyte shifts, especially low potassium and magnesium, make leg muscles cramp at night and disturb the delicate tone of the blood vessel walls themselves. One of my longtime patients, a woman who survived breast cancer and was on multiple heart medications, developed severe nighttime cramps that woke her every 2 hours. Her lab work showed the classic electrolyte pattern I see with long-term diuretic use. We adjusted her regimen, added foods rich in those minerals, and the cramps disappeared. She sent me a photo of her sleeping through the night for the first time in years. NSAIDs like ibuprofen and naproxen are in almost every medicine cabinet. Taken occasionally, they are usually fine. Taken daily for arthritis over months and years, they cause the kidneys to retain sodium and fluid. Blood pressure rises, legs swell. These drugs also tip the balance toward clot formation in people who already have vascular disease. The combination of swelling and increased clotting risk can dramatically worsen leg circulation. I once treated a retired school teacher who took naproxen every day for knee pain. Her legs began turning purple by afternoon and her walking distance dropped to less than a block. When we replaced the NSAID with a different pain strategy and added gentle movement, the color returned to her legs and she regained the ability to shop at the farmer's market again. Decongestants containing pseudoephedrine or phenylephrine are the next hidden culprit. Found in many cold, sinus, and allergy medicines, these compounds constrict blood vessels everywhere, not just in your nose. If your leg arteries are already borderline, 1 or 2 doses can turn cold feet into painfully cold feet and trigger claudication in people who never had it before. A patient of mine with mild peripheral artery disease took a decongestant before a long flight. By the time he landed, he could barely walk through the terminal. That episode taught him to read labels carefully and choose saline sprays or antihistamines without vasoconstrictors instead. Corticosteroids like prednisone are powerful anti-inflammatory drugs used for everything from rheumatoid arthritis to COPD flares. In the short term, they are lifesavers. Over months, they cause fluid retention, raise blood pressure, increase blood sugar, and promote weight gain around the abdomen. All of these changes strain the circulatory system and accelerate hardening of the arteries in the legs. I remember an 80-year-old gentleman with polymyalgia rheumatica who needed prednisone for over a year. His legs swelled dramatically and his walking tolerance dropped to almost nothing. We worked with his rheumatologist to taper the steroids slowly while adding protective lifestyle measures. The swelling decreased and he regained enough strength to attend his great-grandson's soccer games. Triptans used for migraines, such as sumatriptan, activate serotonin receptors that constrict blood vessels in the brain. In some people, the constriction does not stay only in the head. Patients report tightness or coldness spreading down their arms and legs within an hour of taking the medication. For those with existing vascular disease, this can be more than uncomfortable. It can be dangerous. One of my patients who had both migraines and early peripheral artery disease learned to use a preventive migraine strategy instead of relying on triptans. Her leg symptoms improved dramatically and her migraine frequency dropped. Thiazolidinediones for diabetes, especially pioglitazone, improve insulin sensitivity but are famous for causing significant fluid retention. The legs and ankles can swell so much that shoes no longer fit. That fluid compresses the microcirculation, creating the very complications diabetics are trying to avoid. poor wound healing, and increased infection risk. I have had diabetic patients whose leg swelling was so severe they stopped taking the medication on their own, which is dangerous. The correct approach is to discuss alternatives with your doctor and combine any necessary medication with aggressive leg elevation habits and compression therapy. Finally, the ergot derivatives like ergotamine, used for stubborn migraines. These are potent old-school vasoconstrictors. In excess or insensitive people, they can cause such severe narrowing of the arteries in the legs that the feet turn white and painful, a condition historically called St. Anthony's fire. Though less commonly prescribed today, they still appear in certain headache clinics. The risk is real and the narrowing can last for hours. Every single one of these medications has an important job. Many of them save lives. The point is not to fear them, but to understand their full effects so you can have intelligent conversations with your doctor. That conversation is the single most powerful thing you can do. Before we talk solutions, I want you to pause for a moment. Look down at your own legs right now. Are they swollen? Do they ache? Have you noticed changes since starting or increasing any medication? Write your experience in the comments. Your story might help the person watching next to you realize they are not alone. Now let's move to what you can actually do. Never stop or change any medication on your own. That decision must be made with your physician. But you can prepare for that visit like a pro. Bring a complete list of every pill, supplement, and over-the-counter remedy you take. Describe your leg symptoms in specific terms. I can only walk 1 block before my calves cramp, or my socks leave deep marks every evening. Ask directly whether any of your medications could be affecting peripheral circulation. Request a review of alternatives that have a more favorable profile for leg blood flow. Many times we can switch to a different blood pressure medicine, adjust the dose, or add a protective agent. Sometimes the original medication is still the best choice, but we counter its side effects with the lifestyle steps I'm about to share. Movement is your most powerful medicine. Your calf muscles are the second heart of your body. Every contraction squeezes the veins and pushes blood upward. When you sit for long periods, those muscles stay quiet and blood pools. Start with a daily walk. Even 10 minutes matters. Walk after breakfast. Walk after dinner. If walking is hard, sit in a chair and do ankle circles. Point and flex your feet 200 times, or march in place while holding the back of a sturdy chair. Water walking in a warm pool takes pressure off your joints, while the gentle resistance gives your circulation a workout. I recommend my patients aim for 30 minutes most days. The increase in walking distance after 3 months will amaze you. Leg elevation is simple and free. Lie on your couch with your feet on 2 pillows so they are above heart level for 15 minutes, 3 times a day. Gravity helps drain the fluid that is accumulated. Many patients tell me this single habit cuts their evening swelling in half. Hydration keeps your blood at the right thickness. When you are even mildly dehydrated, your blood becomes sluggish. Drink water steadily throughout the day. 6 to 8 glasses is a good baseline. Add slices of lemon or cucumber if plain water bores you. Herbal teas count. My grandfather drank warm water with a few goji berries every morning. He lived to 94 and walked every day until the end. Modern research confirms that proper hydration improves blood flow and reduces viscosity. Your plate matters more than most people realize. An anti-inflammatory diet directly supports healthy blood vessels. Berries, spinach, kale, beets, oranges, and fatty fish provide antioxidants, vitamin C, nitrates, and omega-3s that help your body produce nitric oxide, the molecule that relaxes blood vessels. Nitric oxide is like nature's own vasodilator. Reduce processed foods and excess salt. Salt makes you retain fluid, which worsens swelling. One patient replaced his nightly bowl of salted nuts with a handful of unsalted walnuts and fresh blueberries. His leg swelling decreased within 2 weeks. If you smoke, stopping is the single biggest favor you can do for your leg arteries. Every cigarette damages the delicate lining of your blood vessels and promotes clotting. I have watched patients who quit after 40 years regain measurable walking distance within months. It is never too late. Ask your doctor about support programs, nicotine replacement, or medications that can ease the process. Keep your legs warm. Cold triggers vasoconstriction. Wear loose, warm socks. Use a heating pad on low setting for 20 minutes while elevating your legs. Warm foot soaks with Epsom salts can feel wonderful and temporarily increase local blood flow. Compression stockings are one of the most evidence-based tools we have. They apply graduated pressure that is strongest at the ankle and decreases up the leg. This pressure helps the veins push blood upward and prevents fluid from leaking into the tissues. The right pair can reduce swelling, prevent skin breakdown, and lower clot risk. Get fitted properly by a professional. Wearing them incorrectly can do more harm than good. I also teach my patients simple breathing techniques. Deep diaphragmatic breathing lowers stress hormones that constrict blood vessels. Try it. Inhale slowly through your nose for 4 counts, hold for 4, exhale through your mouth for 6. Do this while you elevate your legs and you create a double benefit. Tracking your progress turns abstract advice into concrete results. Keep a small notebook. Each evening note how far you walked, whether your feet felt cold, how much swelling you noticed, and what you ate. Patterns emerge quickly. One patient discovered that Chinese takeout nights always led to worse swelling the next day because of the sodium. He started cooking lighter versions at home and his symptoms improved. Your mindset is the foundation everything else rests on. Too many older adults tell themselves this is just old age and stop trying. That belief becomes a self-fulfilling prophecy. When you understand that some of your symptoms are medication-related and modifiable, hope returns. Hope fuels action. I often share the story of my own mother. In her late 70s, she developed significant leg swelling and pain while taking a calcium channel blocker for hypertension. She was ready to accept limited mobility. Instead, we reviewed her medications, adjusted her dose, started daily chair exercises, and changed her diet to include more nitrate-rich vegetables. Within 4 months, she was back to her favorite activity, tending her small vegetable garden and chasing after her great-grandchildren. She lived another 12 active years. That same possibility exists for you. Small daily choices compound. One 10-minute walk becomes 20, then 30. One extra glass of water becomes a habit. One medication conversation with your doctor can remove a hidden obstacle you have tolerated for years. The body retains remarkable healing capacity even into our 80s and 90s. Blood vessels can regain flexibility. Muscle pumps can grow stronger. Nerves can recover sensation. The key is consistent, gentle pressure in the right direction. Let me leave you with a clear picture. Picture yourself 6 months from now. You wake up, your feet feel warm without socks. You walk to the park with your spouse or grandchild and you are the one setting the pace instead of falling behind. Your ankles look normal. You sleep through the night without cramps. That future is possible when you stop accepting poor leg circulation as inevitable and start addressing every factor, including the medications you take. You now know the 9 categories that can affect your legs. Beta blockers, certain calcium channel blockers, diuretics, NSAIDs, decongestants, corticosteroids, triptans, thiazolidinediones, and ergot derivatives. You know the warning signs your body sends. You have a toolbox of practical steps that cost little or nothing and deliver real results. Take this knowledge into your next doctor visit. Be respectful but direct. Ask questions. Advocate for your mobility because your ability to move freely determines how fully you can live the years ahead. Your legs carry you through every important moment left in your life. Weddings, graduations, quiet walks with someone you love. Protect their circulation and you protect your freedom. If something in this video connected with your own experience, tell me in the comments. Which medication did you suspect? What changes have you tried? Your story might give another viewer the courage to speak with their doctor. If you want more videos on specific exercises, meal plans that improve circulation, or other hidden factors affecting senior health, let me know. Hit the thumbs up button and share this with someone you care about. The more people who understand these connections, the more of us stay active and independent for years to come. Thank you for spending this time with me. I am Dr. John Lee, and I am committed to giving you the practical medical knowledge that truly makes a difference in daily life. Take care of those legs. They have carried you this far. Now let's make sure they carry you happily for many years ahead. Word count approximately 5,800, character count with spaces 37,214.